Hello, and thank you for joining us for the Medicare 101, brought to you by the Area Agency on Aging 1B and Medicare Medicaid Assistance Program, MAP. My name is Melissa Devine, and I'm the site coordinator for the Livingston, Washtenaw, and Monroe Counties MAP program. Today, we're going to cover who MAP is, what MAP does, what Medicare is, and more. Let's first start with MAP Inc. MAP is comprised of unbiased counselors located all across Michigan, offering free health benefit counseling assistance. Our MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, MAP is called the State Health Insurance Program. So how can a MAP counselor help you? Well, we can help you understand Medicare health plans, compare and enroll in Medicare Advantage coverage, compare or enroll in Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, and assist with enrollment into low-income programs. Now let's take a look into Medicare. What is Medicare? Well, Medicare is insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease, often referred to as ESRD. It is administered through the Centers for Medicare and Medicaid Services, and enrollment takes place through Social Security Administration for most, and the Railroad Retirement Board for the railroad retirees. Medicare has well-defined benefits and exclusions. It typically does not cover dental, hearing, or vision care except under special circumstances. It does not cover long-term custodial care, and it places limits on certain care items such as physical therapy, durable medical equipment, etc. It also does not cover over-the-counter medications. However, Medicare works with private insurance companies to provide Part D prescription drug coverage, supplemental plans, which are referred to as Medigap plans. They help to fill in the gaps in original Medicare, and Medicare Advantage plans, which combine parts of original Medicare, usually with prescription drug coverage, and often some extra benefits like dental, vision, and hearing coverage. If someone's already receiving Social Security benefits, for example, getting early retirement, they will automatically be enrolled in Medicare Part A and Part B without any additional application. They'll receive an initial enrollment period package, which includes their Medicare card and other information about 3 months before they turn 65. If somebody is receiving Social Security benefits for disability, that same packet will be received 3 months before their 25th month of disability benefits. For those who receive Railroad Retirement benefits, you'll receive that from the Railroad Retirement Board. If someone is not getting Social Security or Railroad Retirement Board benefits, let's say you're still working, then you will need to sign up for Part A, even if you're eligible to get it premium free. And they should contact Social Security 3 months before turning 65. If you worked for the railroad, you'll want to contact the Railroad Retirement Board to sign up. While Medicare is administered through the Centers for Medicare and Medicaid Services, Social Security is responsible for enrolling most people into Medicare, and the Railroad Retirement Board is responsible for enrolling railroad retirees. To enroll with Social Security, you can visit their local office, call their 800 number listed on this slide, or visit them online at ssa.gov. If you're retired from the railroad and you want to enroll with the Railroad Retirement Board, contact your local Railroad Retirement Board office at the 800 number listed here. Here's a look at the original Medicare ID card. You can see that it'll include the beneficiary name, the unique combination of numbers and letters, which is your Medicare ID number, or health claim number, and it'll show what coverage you have with Medicare, Part A or Part B, or both, along with the date in which the coverage began. If you're interested in keeping your Part B benefits, you'll keep the card. If you decide that you only want Medicare Part A at the time, and you want to refuse your Medicare Part B, you'll want to look at the back of the card and follow the instructions. There's 4 parts to Medicare. Part A, hospital insurance. Part B, medical insurance. Part C, Medicare Advantage, which are the HMOs and PPOs. And Part D, the Medicare prescription drug coverage. When you first enroll in Medicare, and during certain times of the year, you can choose how you receive your Medicare coverage. There are 2 main ways to get it. First is with Original Medicare, which is going to provide you coverage for the hospital and medical insurance through Parts A and Part B. You then can add a separate Part D plan for Medicare prescription drug coverage, and you can also add a Medigap plan or Medicare supplemental insurance. These Medigap policies help pay your out-of-pocket costs in Original Medicare. The second route would be Medicare Advantage, also known as Part C. Medicare Advantage plans are an all-in-one alternative to Original Medicare. These are bundled plans that include Part A, Part B, and usually a Part D plan, all in one. They may have lower out-of-pocket costs than Original Medicare, but in most cases, you're going to have to use the doctors that are in the plan's network. And some of these plans may offer extra benefits like dental, vision, and hearing. Let's take a look at Original Medicare, Part A and Part B. Medicare Part A hospital insurance helps to pay for medically necessary services with hospital inpatient care, semi-private rooms, meals, general nursing, other hospital services, and supplies, skilled nursing facility care, not custodial or long-term care, when certain conditions are met, home health care, hospice care, and any blood that you may need as an inpatient. Medicare Part B covers a number of medically necessary services and supplies, like visits at the doctor's office, outpatient hospital services, clinical lab tests, and preventative services. This is a look at the Part A costs for 2022 if you have Original Medicare and do not have a Medigap policy. When Medicare bills for Part A, they bill on a benefit period, so you may be responsible for the Part A hospitalization deductible more than once in a year if needed. However, each benefit period, if you are hospitalized, the first 60 days you're responsible for the Part A deductible, which is $1,556. Days 61 to 90 are a $389 a day copay. Days 91 to 150 are $778 a day copay. Beyond 150 days, all costs are your responsibility. If you need skilled nursing facility care and have been admitted to the hospital for 3 full days, your first 20 days are covered with no cost to you. An additional 80 days, though, is up to $194.50 a day. Anything beyond 100 days, all costs would be your responsibility. You have coverage for home health care, up to 100 visits following a 3 full day hospital admission, as long as you meet Medicare conditions, and you'll pay nothing for the services, but 20% for the approved amount of durable medical equipment. If hospice care is needed, as long as the doctor certifies, there are really limited costs, and only those costs are for outpatient drugs and inpatient respite care. If blood is needed while in the hospital or skilled nursing facility, you have access to an unlimited amount if medically necessary, and your responsibility is only for the first 3 pints. For Medicare Part A, there typically is no premium for most people. However, if you have 30 to 39 working credits, you can expect to pay $274 per month. If you have less than 30 working credits, you can expect to pay $499 per month for the premium. Again, though, that is a very rare situation, and more times than not, Medicare Part A is premium free for most. Now, this is a look at the Medicare Part B costs for 2022. If you need to go to the doctor or need doctor services, your benefits are unlimited as long as medically necessary. You will, however, be expected to pay 20% of the approved amount after meeting the $233 annual Part B deductible for 2022. Any clinical lab services are unlimited if medically necessary, with no cost to you. Home health care is unlimited as long as you meet the Medicare conditions, and again, you pay nothing for the services, just 20% for the approved amount for durable medical equipment. Any outpatient hospital treatments are unlimited if medically necessary, and again, are responsible for 20% of the billed amount after meeting the $233 annual Part B deductible. Any blood that's needed is unlimited if medically necessary, and you're expected to pay for the first 3 pints plus 20% of the approved amount for any additional pints. The monthly premium for 2022's Part B coverage is $170.10 per month. So what is Medicare Part D? While technically Part D is optional, in most cases there are penalties to not getting it. And it can be the most complicated part of enrolling in Medicare. It involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. People with limited income and resources may be able to get extra help to pay for their Medicare drug plan. Part D is available for all people with Medicare. You can have just Part A or have both Part A and B. However, you must live in the plan service area. You cannot live outside the U.S., you cannot be incarcerated, and you must enroll in the Part D plan. This can be as simple as completing an application online, and a MAP counselor can help with this. In most cases, enrollment into Part D is not automatic. Medicare Part D is prescription drug coverage. The coverage is provided through Medicare prescription drug plans. It sometimes can be provided through a Medicare Advantage plan and potentially other Medicare plans. But Part D plans must cover a range of drugs in each category: immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and antineoplastics. You can join a Medicare prescription drug plan when you first become eligible for Medicare. So during that initial enrollment period, which begins 3 months before you turn 65 or you're entitled to it, the month that you are turning 65 or entitled to Part D, and 3 months after you're entitled to Medicare because you're turning 65 or are allowed to have it. After you enroll in your prescription drug plan, you must remain with that plan for the rest of the calendar year unless you qualify for a special enrollment period. You can also enroll in a Medicare Part D plan during the annual open enrollment season, which is October 15th through December 7th. Any changes that are made during the annual fall open enrollment period will begin January 1st the following year. There are also times when you may be able to disenroll or get a special enrollment period. We could have a whole presentation on that alone. All of this, though, is covered in the Medicare and U-Book, and a Medicare and Medicaid Assistance Program, or MAP, counselor can also assist you with this information. So, to join the plan, you can either call the plan directly, visit Medicare.gov, or call MAP for further assistance. Now let's talk about Medigap policies. Medigap, or Medicare Supplemental Insurance policies, are private health insurance that cover the policyholder only. They are sold by private insurance companies to supplement the original Medicare coverage, like deductibles, coinsurance, and copayments. They pay for Medicare-covered services provided by any doctor, hospital, or provider that accepts assignment to Medicare. Medigap may cover certain things that Medicare doesn't, depending on the Medigap plan. But they all must follow federal and state laws to protect people with Medicare. Again, we could do an entire presentation on Medigap. But we're going to take a look at the next slide, which is going to show what Medigap policy covers. Every Medigap policy has to cover the basic benefits, which include the Medicare Part A coinsurance and hospital costs, the Medicare Part B coinsurance or copayments, the first 3 pints of blood, and the Part A hospice care coinsurance or copayments. Anything beyond those basic benefits are considered to be extra benefits or enhanced. You can see that as you go down the list of letters, that plans B through N cover a little bit more, like the Part A deductible, which for 2022 is that $1,556 amount, and more. Please note, though, that Plan C and F are no longer sold to beneficiaries who became eligible for Medicare on or after January 1st of 2020. So the next best plans would be G or D. Now let's take a look at Medicare Advantage Part C. Medicare Advantage is also called Part C. They're health plan options provided by Medicare, run by private insurance companies, and are either an HMO or a PPO. Medicare pays amounts for each member's care, and the Advantage plans are another way to receive your Medicare coverage. If you join, you will have to use their network of doctors or hospitals. Medicare Advantage plans, or Part C, are health plans that are approved by Medicare, offered by private insurance companies that sign a contract with Medicare. They're part of the Medicare program, and so you still receive your Part A and Part B services, and you will often receive prescription drug coverage through the plan. The plan may even offer extra benefits like hearing, vision, or dental, but the cost sharing is different than original Medicare. There may be set copays, a maximum out-of-pocket, and more. You can join a Medicare Advantage plan when you first become eligible for Medicare during the initial enrollment period. Again, that's 3 months before you turn 65 or are entitled to Medicare, the month that you turn 65 or are entitled to Medicare, and 3 months after you turn 65 or are entitled to Medicare. You can also make changes during the annual fall open enrollment period, October 15th through December 7th each year. Again, any changes made during the open enrollment season in the fall, that coverage will begin January 1st the following year. If you are enrolled in a Medicare Advantage plan January 1st, you also have access to the Medicare Advantage open enrollment period, where changes can be made January through March, with the effective date for the coverage beginning the month after the enrollment takes place. To enroll, you can contact the plan to join directly by calling their number. You can visit Medicare.gov or contact MAP for further assistance. Now let's touch base on Medicare wellness and preventative services. All new to Medicare individuals get a Welcome to Medicare visit with their doctor. It's a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the exam, the doctor will review your medical and social history, your height, weight, and body mass index, simple vision tests, potential risk factors for depression, review of functional ability and level of safety, and more. You'll get advice on how to help prevent disease, improve your health, and stay well. You'll also get a brief written plan, like a checklist, letting you know if any additional screenings or preventative services are needed. At this visit, the doctor may also refer you to additional Medicare covered screenings as a result of the initial Welcome to Medicare visit. There's no cost if the doctor accepts Medicare assignment, and this is a great benefit that people can take advantage of. Medicare also covers a yearly wellness visit. So after you've had Part B for more than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months. And during this visit, your doctor will record your blood pressure, height, and weight measurements, review your potential risk factors for depression, review your functional ability and level of safety, give you advice to help you prevent disease, improve your health, and stay well. And you'll also get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. You don't need to get the Welcome to Medicare visit before getting an annual wellness visit. However, if you do choose to get the Welcome to Medicare visit, you will have to wait a full 12 months before you can get your first annual wellness visit. Again, you'll pay nothing for this exam if the doctor accepts assignment to Medicare. In addition to the Welcome to Medicare visit and the yearly Medicare visit, Medicare covers a number of other preventative and wellness services. This is a brief look at a few of those wellness and preventative services that are covered by Medicare. There are many other services covered, such as bone mass measurement, glaucoma tests, diabetes self-management training, and obesity screening and counseling. But you can see here that mammograms are covered every 12 months for women over 40 at no cost. Prostate cancer screenings are covered every 12 months for men over 50 at no cost for the test and 20% coinsurance for the doctor's visit or hospital copay. You even have coverage for colonoscopies, cardiovascular screenings, pap smear tests and pelvic exams, and flu shots. Medicare also covers recommended adult vaccines like the flu, preferably before flu spreads to your community, although there is benefits to receiving the vaccine afterwards. It also covers your tetanus, diphtheria, pertussis, or Tdap. It'll cover the pneumonia vaccine, shingles vaccines, including the new Shingrix, the mumps, measles, and rubella, or MMR, hepatitis A and B, and meningococcal A and B. And with COVID-19, it also covers your first 2-dose vaccines and your boosters. You always want to consult with your doctor or pharmacist on what vaccines are recommended for you. Medicare Assistance Programs. There are programs available to help people with limited income and resources pay their Medicare costs. These include Extra Help. This is for your prescription drugs. Medicaid and Medicare savings programs to help cover the medical portion, pharmaceutical assistance programs, and prescription saving cards like GoodRx. Now let's take a brief moment to talk about Medicare fraud and abuse. Medicare fraud is the most common scheme affecting seniors. Medicare, Medicaid can be billed for services you never got or equipment you never received or was returned. If someone uses your Medicare or Medicaid card, or a company uses false information to mislead you into joining a Medicare plan, those are all fraud and abuse situations. MAP can assist you if you've been a victim to fraud or abuse. Not only can we help you get out from under that, but we can help you report that and stop those thieves and fraud and abusers in their tracks. So give MAP a call if you've experienced any of these situations. MAP is here to help you. If you want to speak with a counselor about your specific situation, just give us a call. We're currently counseling over the phone and through Zoom, but our service is confidential and it's unbiased. No question is too trivial, and we often deal with very complicated situations as well. For resources outside of MAP, you have access to the Medicare U-Book, which is state-specific and should show you specific plans for Michigan. You receive a hard copy each fall and can access an electronic version all year online. You can also reach out to Medicare through medicare.gov or calling 1-800-MEDICARE. However, for your best resource for local Medicare information, that's MAP. Again, our services are free and unbiased. Our certified counselors are not sales agents and they're not affiliated with private insurance companies. We can be your best resource for all questions and concerns Medicare. No question is too small or difficult. And we've saved over $2 million for beneficiaries in your area. Give MAP a call, 800-803-7174. Thank you so much for joining me today. If you have any questions or need any further MAP assistance, you can reach out to me at mdevine@aaa1b.org or give MAP a call at 800-803-7174. Thank you.